สวัสดีค่ะ and good afternoon. Welcome back to the English language summary of the daily press briefing on the COVID-19 situation, live from the Center for COVID-19 Situation Administration, or the CCSA. Today's briefing, which is Sunday, the 23rd of May 2021, I'm following the briefing from Dr. Tuisin and also Dr. Opat Gawin-Pong, who is the Director General of the Department of Disease Control, because today he has addressed very important news regarding the detection of a South African COVID-19 variant in Thailand. So I would summarize both of the kind doctor's briefings. So let me start with the briefing from the Director General of the Disease Control Department. So he just told us that there has been the COVID-19 B1351 variant first detected in South Africa, reported in Tak by district of Narathiwat province. We are closely monitoring this particular variant because there has been some data that some vaccines might not respond well to this particular variant. However, vaccines still can prevent from severe symptoms from the virus. And it is also lucky to report that this particular variant does not have severe symptoms. And so this particular case, we'll look into it right now, was found that on the 10th of May, the head of the Emergency Operations Center, or the EOC in Songkhla province, was alerted by a provincial health office in Narathiwat province that a Thai male businessman who was 32 years of age in Tak Bai district had tested positive for SARS-CoV-2. And this case was identified as an index case or an origin of a new cluster of infections. And therefore, this case was investigated thoroughly to assess the spread and the source of the virus, as well as risk factors of the local transmissions and initial recommendations on disease control measures. And this Thai male businessman had fallen ill on the 26th of April when he started to develop a fever, a cough, and physical aches, and had bought some medicine to treat himself from a pharmacy. Then, on the 30th of April, he was admitted to Tak Bai Hospital for medical treatment and stayed for one night. Following that, on the 4th of May, he was admitted to Sirorod Hospital in Yala province, and there he was tested for SARS-CoV-2, and the test was positive. Following that, on the 5th of May and the following day, the patient was transferred to receive medical treatment, and at that time, his travel history was unclear. However, his close contacts had informed later on that he may have traveled back from Malaysia and that his family had visited him. His family had previously traveled across the Malaysian border, and they had traveled without passing a disease control checkpoint or undergoing quarantine. So during 12th of April to 4th of May was the time that they were in Thailand, and they have since traveled back to Malaysia. So this particular male, this patient, has now recovered and has since been discharged from hospital already. And health authorities have been investigating close contacts since the first since they first detected this infection in April. And they found that there are 698 high-risk close contacts. And of this number, 81 cases, or 11.6% of these close contacts, have tested positive. In addition, active case finding has been conducted on 160 people in the community, and 2 people, or 1.25%, were found to be infected. And therefore, we have 83 cases so far detected and are being treated at hospitals. 16 of these cases have now recovered, and 67 cases are still being treated at hospitals. We are very happy to report that no deaths have been reported from this cluster. And I'd also like to stress that the numbers that I reported just now are not newly confirmed cases, but they've already been reported and included in our daily tallies. This is just a summary of this particular cluster. So the sub-district, or Tambon Got Sathon, has now, so this is the origin of where the variant of this virus was found. So this particular sub-district has now been in lockdown since the 8th of May until 22nd of May, that's yesterday. And from today on, 23rd of May, checkpoints have been set up around the sub-district until the situation improves. So there will also be additional local quarantine facilities set up to isolate high-risk close contacts. And also the EOC at Tak Bai is closely following and evaluating the situation on a daily basis. And we want to say that the situation now is under control, and there are no new infections, and the CCSA will definitely keep you informed of any further updates on this case. So moving on forward, I'd like to recap just a little bit more to explain a little bit about a vaccination for foreign nationals, to continue from yesterday, and also to respond to some questions that we've found on social media. Just to explain that we did talk about vaccination for 5 groups of foreign nationals, and I'd like to clarify that foreign nationals are divided into 5 groups just to facilitate a speedy vaccination process by assigning a host agency to oversee each group. The CCSA would like to emphasize that all foreign nationals in Thailand are eligible to be inoculated. So by all means, we are not limiting foreign nationals by categorizing in groups in any way. This is just to speed up the process and to make it as swift and smooth as possible. And those who belong to the 5 groups should register or contact the agencies responsible for handling their vaccinations. And they will be vaccinated at centers that the host agency has arranged for them. So, for instance, just putting this out in practical terms, if you are a retiree, for instance, on a non-immigrant O visa, and you've not been registered by your workplace or any organization, you should first go to the hospital where you have your medical history or records. And if you do not have a medical history at any hospital, you can go to Wimut Hospital or Bang Rak Vaccination and Health Center, or any other facility that the Council of University Presidents have designated, or other sites that the Public Health Ministry has designated. This is just an example. And however, those who do not belong to the 5 groups in the list, that you found that, or you feel that you don't belong in any of those groups, well, you can go to the on-site registration service centers that I mentioned just now, or just go there just to register for vaccination. And if vaccines are available, you can get inoculated on the day of registration. If all vaccines for that day have already been allocated, you will receive a cue card for the following days, which will ensure that you have an appointment for vaccination. And please be reminded that this starts on the 7th of June onwards. So don't rush to any centers right now. Please wait a few more weeks. And also to avoid crowding, you might not need to go on the very first day as well. And another important reminder is that if you've already been registered by your organization or workplace, then please do not register again through other channels just to avoid duplication. Okay, so that's it, what I have today for vaccinations. Now I'd like to move along to the general situation, the numbers that was reported by Dr. Tawisin just now. Today we have the number of new confirmed cases standing at 3,382. Of this number, 2,922 are from local transmissions and 460 were detected from prisons, and an additional 5 were from overseas. So in total, we have a number of accumulated confirmed cases standing at 129,500 cases. There are now 44,189 cases that are still active, being treated in medical facilities, and 1,210 in critical condition, plus another 412 on ventilators. We have today 2,131 new recoveries. That makes us standing at 84,535 total recoveries. We have today reported a number of new fatalities at 17 cases. So the accumulated number of fatalities now stands at 776. And of course, our sincerest, deepest condolences to the families and friends of the deceased. Most of the fatalities today had underlying health conditions of high blood pressure, diabetes, high cholesterol, and chronic disease of kidney disease. Majority of these cases were reported from Bangkok and Songkhla and Chiang Mai, one each. So on observations, particularly in Bangkok and its vicinity, are still hotspots and have rising number of infections. So also to note that the situation in provinces outside Bangkok is also getting worse. We have several large clusters of infections found, mostly in markets and factories in Phetchaburi, in Chat Cheong Sao, Chonburi, Ratchaburi, Nakhon Ratchasima, Yala, Narathiwat, Songkhla, Surat Thani provinces. And we have to note that today we found the first time in the current wave of COVID-19 where the number of reported cases in the provinces outside of Bangkok has surpassed the number of cases in Bangkok and its vicinity. So what will we be doing in the new measures for Bangkok? Since infections continue to increase in the past few days in Bangkok, especially in construction campsites in Laxi district, where we reported already 1,100 workers tested positive for COVID-19. So as part of the efforts to contain the outbreak in this particular area, we have now implemented a bubble and seal measure to prohibit the movement of workers at this particular construction site at Laxi. However, the workers or construction can still move forward within the bubble. They can continue to work. And in addition, the Laxi District Office aims to launch a vaccine campaign to vaccinate all locals in this administrative area starting from 25th of May until the 29th of May. And this will be taking place at Bangkok Primary School. Also at Busalakam Field Hospital, we're now able to accept more COVID-19 patients, and therefore the Ministry of Public Health will be installing an additional 1,000 beds at this hospital to meet the demand from increasing COVID-19 patients. So, a very short introduction just to let our viewers know that if you want to travel to Chiang Rai, there are new restrictions. They have now in place restrictions for travelers from Bangkok, Nonthaburi, Pathum Thani, Samut Prakan, who enter Chiang Rai. All of travelers from these provinces must be fully vaccinated or have a negative COVID-19 test certificate issued within 72 hours prior to their travel. Otherwise, they are subject to a 14-day quarantine at a government or local facility. Okay, before I end the briefing, I also have some numbers of vaccinations to report the progress to date. As of yesterday, 22nd of May, Thailand has administered more than 2.86 million doses. We are getting close to 3 million doses. And of this number, almost 1.9 million are the first doses, and more than 965,000 are second doses. So, before I end, we have one more slide just to remind everyone that while we are still in quarantine and working from home, we want to be reminded that exercise is very important to curb the spread of COVID and to keep on staying healthy and strong and fit, because exercise can make all the difference. If you ever fall victim to the virus, exercising actually could be a potential savior to your life. And this is all I have for you today. Thank you very much for your kind attention. We'll see you again tomorrow. ขอบคุณค่ะ สวัสดีค่ะ